I would like to introduce our speaker for today. It's the wonderful Kimberly Rice-Smith. She is an HSS Division Nursing Clinical Nurse Leader, and she's been with HSS since 2015. She works as a clinical nurse leader, as mentioned, and she focuses on quality improvement, patient safety, and staff education. And so for this program, which talks a lot about communicating with your physician to ensure the best healthcare, we are so lucky to have Kimberly with us and to share a bit of her knowledge and expertise. So without further ado, Kimberly, I'm going to give you the floor.
Great. Thank you so much. I am so excited to be able to talk to you all today. It's really been a pleasure to work with Roberta and Cortland as we've prepared to have nursing come and do some more of these sessions with your group. So I'm really excited to talk about this topic. It's a topic that I'm pretty passionate about. One of the roles that I have done at HSS has been as a complex care navigator. So working with patients who have more complex medical issues come through our system as they have surgery here at HSS, and reaching out, speaking with them before and after surgery at home, and coordinating appointments, helping to troubleshoot issues before they get escalated to the doctor. So it's a topic that is really near and dear to my heart. So I hope that you all are able to get something out of it. And without further ado, here we go. How to communicate with your physician to ensure the best healthcare for you. Next slide. I have no conflict of interest to disclose. Next slide, please. And I am presuming that many of you are already affiliated with HSS, but when we do this presentation out in the community, not everyone is. And one of the things that I love about HSS is that our mission is to provide the highest quality care to patients to help them improve mobility, enhance their quality of life. So really that piece of getting back to what you love to do and what you need to do. So next slide, please. And one of the things I think that's kind of shocking, but probably not so unexpected, is that Americans on average only get 18 minutes with their doctors per visit. So you think of how long you take to travel to your doctor, to wait in the waiting room, to get seen by the nurse, the medical assistant, all those things. You only get 18 minutes with your doctor during that visit. So how to make the most of those 18 minutes. Next slide, please. And then once you're in the room and you're talking to your doctor, on average, patients forget about 58% of what they're told in that 18 minutes. And so that's not the fault of the patient. It's not the fault of the doctor. Sometimes it's fault of the doctor, but really what it is that's how humans are. We're not not everybody remembers everything they hear. So utilizing multiple ways of presenting information and then remembering information are key to making the most of your doctor's visit. Next slide, please. So this can lead to a lot of, miscommunication, misunderstanding of what you need to do. And that is frustrating, but it also in some circumstances can be life-threatening. So it's so important to really make sure you understand what the plan is going forward when you see your doctor. And most people who report that they have a good relationship with their doctors are more satisfied with their care and have better results. Next slide, please. fun fact, 80% of medical diagnoses are based on the patient's history. So that translates to what you tell your doctor. It can be what reports you give them from your previous doctors. It can be what you verbally say, but the majority of diagnosis is based on what the questions that the doctor is asking you and then what you tell the doctor. Next slide, please. And that can be a big barrier. That can be really tough based on things like implicit bias, based on race, gender, ethnicity, other preconceptions and stereotypes. It can be a barrier based on your past experiences with medical care and a lack of trust. It can be affected by power differences. Going into that doctor's office can be really intimidating sometimes. Or you just don't feel like the person you're speaking to really understands what you're telling them. It can be inhibited by a lack of shared decision-making, a feeling of disempowerment, and then just the environment of the waiting room, of the staff who are assisting you. Anything can really kind of get in the way. So figuring out some tips and tricks to kind of get past that, cut through those barriers, and get what you need out of the visit is key. Next slide, please. So I'm going to go over most of these things later on in the presentation as well, but this slide is kind of a good key takeaway slide of good questions to outline your visit. So if I have a new diagnosis, what does it mean and how can I learn more? Is this test or treatment really necessary? What are the risks? And risks include, are there side effects of the treatment? How often are the results accurate if it's a test? Because sometimes you take a test and you get a false negative or a false positive. So what are the risks of that happening? Are there simpler or safer options? That is always a good question to ask. The doctors can be quick to prescribe medicines, prescribe treatments, prescribe surgeries. And the good thing to remember is you don't have to do any of it without learning more. It's always up to you. And that brings us to that next point. What happens if I don't do anything? You know, what is my life going to be like, or likely to be like, if I don't follow this path of treatment? And then also, as with anything, how much does it cost? Because that is a huge factor in healthcare. Next slide, please. So with the next few slides, hopefully, I'm sure many of you are already very well educated healthcare consumers. Interacting with our medical system with lupus can be a big challenge. But hopefully these next few slides will give you a couple of good tips to take away to your future appointments. Next slide, please. So, and you can, I think there's more on this slide, perfect. So one big important key factor when going to a new doctor especially, but even a doctor that you've been with for a while, is to know your health history and have it organized. So either whether that's on paper, in a file folder, or a notebook, or an electronic record, something that you can bring to your doctor's appointments and refer back to. It should include your lupus health history and current symptoms, allergies, all medications, including over-the-counter, which includes any vitamin supplements, any herbal remedies that you might be taking, anything like that. So, history of your surgeries and any hospital visits you've had, and then current health problems. Next slide, please. As you prepare for your doctor's appointment, make sure you know when it is. That's always a tough one for me. I've got my little Google Calendar in my phone to give me reminders. And write down a list of all your questions, concerns, and previous issues or symptoms that you've had. One really good way to do this is to keep a diary or journal of your symptoms or flares, and we'll talk more about that in the next slide. Bring a list of all your medications. If it is easier for you to bring your medications with you, then that's okay. Having the medications written out on a piece of paper or in an electronic document that you can refer to and easily update is definitely the best way to communicate that and to keep track of them. And then it's always a good idea to arrive early if you can. Not always possible with the subways and cabs. Next slide, please. So more about this health diary or health journal. Things you want to mention in the diary are how you felt on your good days, on your bad days. This will help you identify if there are any side effects to any of the medications that you're on. Give you a way to track your pain, your energy level, your mood changes, and then what are things that are going on when your lupus symptoms are decreasing, increasing, and help to make those connections between actions and environment and food and all those other types of things and your symptoms. Next slide, please. One way that you can track this is, if you don't use it already, HSS has created an app to help track symptoms and medications and doctor's visits and all that stuff. So that is available if you would like to use something like that. Next slide, please. And then another really great idea is, if you have a doctor's visit, have a friend or a family member go with you. It is not always possible, and it's not always something that you might not have a person who you want to share those intimate details with about your health. But if at all possible, 2 sets of ears are way better than one. The original slide that I put on saying that patients forget about 60% of what their doctors tell them. If you have 2 people there, then that cuts down to maybe you'll remember up to 80% of what the doctor says. So that can be really helpful to have another person to listen and to ask questions. Next slide, please. So as you prepare to talk to your doctor during your visit, there's a couple of key points when you're interacting with your doctor. So whether you have a good relationship with them, whether you have an uncomfortable relationship with them, whether it's somebody new and you don't know what kind, you're trying to create a relationship, a few things are key. So trying to explain as clearly as possible what's going on, and then to avoid downplaying your lupus symptoms. Everyone's symptoms are different, and so being precise about what you're feeling and what you're experiencing are so important. And that's where the journal can come in, because sometimes, if you're feeling better, if you happen to be feeling better that day, your memory can kind of downplay, oh, it wasn't that bad, I don't want to seem like I'm complaining. But if you have it in that journal, then you can say, no, I rated that symptom a 9 out of 10. It was really bad. So being able to kind of speak to that specifically. And then just notice how your doctor makes you feel. Do you feel validated when you talk to them? Do you feel intimidated? And then just noticing that can help to manage expectations during the visit. It's helpful to be focused, and that the journal and the checklist, making a checklist of your main questions and concerns, which we'll talk about in a few slides, can be really helpful in focusing the visit and bringing it back to your priorities and what you want to get out of the visit. And then using assertive language, emphasizing what's important to you. Next slide, please. And next slide. So these next few slides are going over like a typical visit. So you walk in, you see your doctor. You're in the waiting room, they come in, actually, is how that goes. So you want to discuss what is bothering you. So you make a checklist of the top priorities that are the reason you're at the doctor that day. The doctor will probably ask you some clarifying questions. And then there'll likely be a physical exam. If it's an initial exam with a doctor, there might be what we call a head to toe exam, which includes all the body systems. But more likely than not, it'll just be focused on the issues that you're there for that day. And then any lab work, either being drawn or a discussion of the results. Next slide, please. At the end of the visit, there'll be a discussion of the treatment plan. If you have any new diagnoses or concerns or questions, that is when those will be brought up. And then if there are any medication changes, and then when to make a follow-up appointment. Next slide, please. So in the first 5 minutes of your visit, you want to review those notes that you took and review them with the doctor. So what are the things, what are the main questions that I have? What are the main issues that I have here today that I'm coming to you for? And what you hope to get out of the visit. So that helps you to put you in control of the appointment and helps to focus the visit on what's important to you. Next slide, please. And after reviewing your list, you want to tell the doctor what are the top 2 or 3 most pressing issues. And if in his or her perspective, those are the most critical issues. You may not have all your problems addressed in one visit, but that's okay. You know, even bringing them up, and sometimes doctors are able to message with patients in between visits or something like that. So that might be a good way to address less critical priorities. And then if you find that the visit is kind of deviating from where you want to go, or that something hasn't been addressed or answered in a way that's satisfactory to you, you can always bring it back up. You can always refocus if necessary. Next slide, please. Minutes 7 to 15 are usually focused on the physical exam, so that's a good time to explore the way you're managing the lupus symptoms. And to be honest, it can be tough, especially if you don't feel comfortable with your doctor, but bringing up symptoms that, you know, may be embarrassing or uncomfortable, it truly is the time to do it, because that way they'll start to get addressed. And if your doctor doesn't address them, then we'll go over in a few slides how to deal with that. Next slide, please. So after all this has happened, your doctor's heard your concerns, done their examination. Now it's time for a treatment plan. So the doctor should summarize their recommendations for you at the end of the visit. If they don't, you can always ask them to. And then after they discuss that plan with you, make sure to repeat it back. That will let you and your physician know that you're on the same page. And it will give you a chance to review your list of reasons for the visit and to make sure that this plan addresses all of those reasons that you came to the doctor for today. Next slide, please. And this is just a good mnemonic, I guess. It's these three questions you want to do. Number one, what's my main problem? Number two, what do I need to do? And number three, why is it important for me to do this? So make sure that every time you talk to the doctor, you're getting answers to those three questions. Next slide, please. So the treatment plan often will include changes to medications. So if that's the case, making sure you're clear on what is changing. Is it the dose? Do I need to stop any medications? Do I need to start any new medications? Are there any changes in diet, exercise, or other types of things, environmental factors? And are there any new diagnoses that I have to, consider, learn about, wrap my head around? And again, emphasizing, repeat the instructions back to make sure that you both are on the same page and that you're understanding everything you have to do. Next slide, please. So when you get a new diagnosis, it can be really intimidating, uncomfortable. Sometimes it can be relieving. You're like, finally, I have an answer for this. So making sure that you really understand what the doctor's talking about when they give you that new diagnosis is key. So making sure you know exactly what the name of the diagnosis is and what does it mean in plain language. What should I expect in the future? What is the typical progression of this diagnosis? What are the typical treatments? That type of stuff. Specifically about treatment, what are my treatment options? There's never only one treatment for a diagnosis. There's always, as we said earlier, there's always the option of doing nothing. How good an option that is depends a lot on what it is, but so making sure you talk with the doctor about what are the pros and cons of my treatment options. How soon do I need to make a decision about treatment? And that's key too, because if it's a treatment that's really going to be affecting your life in a big way, giving you, do you have time to kind of think about it, talk to people you trust, talk to people you love about implementing that treatment before you go ahead and start it? And then how should I best balance this treatment with my other lupus treatments? How does it affect my regimen that I'm already doing? Next slide, please. It's important to know if you need any additional tests. If so, what kind and when, and how invasive are they? And then if appropriate, are there any clinical trials that are right for me? If it's a rare diagnosis or if it's something that is pretty serious that is not, there's not like a standard treatment for, clinical trials may be the right thing. Asking about any changes, how is this going to affect my life? Do I need to incorporate different activities and strategies in my new daily life? And then what resources are there available for support and information? So this workshop is a perfect example of a great resource that's available for people going through lupus. So are there other ways in which to cope with this diagnosis and get support? Next slide, please. So if you do all these things and at the end of the day, you're still like, man, my doctor, things aren't working out. If you can, feedback is always a good idea. It is a very important tool that you can employ to make sure that your needs are being met. So it's not always easy to give that feedback, but one example is, so the doctor tells you something and you really just don't understand what they're saying. You can say, I'm not sure I understand that medical term. Can you explain that again, please? And that doesn't put the blame on the doctor. It doesn't put the blame on you. It just acknowledges that you need this explained again, please. And that sometimes can be enough. But if it's not, and you really feel that your doctor is not listening to you and is not, interested in your health, you do not have to settle. You have choices. It may be time to change doctors or explore other doctors in the same practice. And then also using spaces such as this workshop to talk to other patients, to reflect on your experiences and get ideas for how to interact with provider, either this particular provider or providers going forward. Next slide, please. So then to prepare for your next visit, go back to that journal and that checklist. If your symptoms haven't changed very much and it's just a check-in, you can go back to the same checklist, or you can write a new one if there's a new development in your symptoms or plan. And then use the same steps to prepare for the new visit that you did for the one you just did. Next. This slide is new based off of my experience with working with post-surgical patients, and after when you're at home and you're trying to decide, should I call the doctor or not? Is it worth bothering them? Is it worth, sometimes people can be really hesitant about reaching out to their doctors. So if you have a cough, infection, or non-healing wound, it's important to call. If you have questions, call. Those offices are there to care for patients. So any questions, call, or use the text messaging feature if your doctor has that capability. If you are waiting on test results and any prescription refills, with prescription refills, it's important to not wait until the last minute. I recently did this with some medication of my own, and it was annoying, and I went a couple days without it, which is awful. So make sure that you have the pharmacy information, all that stuff. That's easy information to just gather together before you make the call, to organize yourself and make sure that you get what you need right away. And so this is something that I found often with patients is when you call your doctor, make sure that you just take a moment to organize your thoughts. especially if it's something that you're anxious about or that is really painful or concerning. It can be easy to call the doctor and then be like, I don't know what's going on. I'm scared and I need you to help me. So taking a moment to write down, what is the problem? When did it begin? And then have a place to write down the instructions that the doctor gives you can be so helpful in making sure that you are getting your message across and your needs across, and then that you're understanding what the doctor is telling you to do going forward. Other things that are important to notify the doctor about are if you have a fever or increased pain or other symptoms of a flare, worsening or new onset of symptoms, or if you have a fall. Next slide, please. All right, so now we will, I think, be opening it to questions. Yeah, we're a little early, that's good. More time for questions. So just reflect a little bit on if there's anything that you learned from this presentation, if there's anything you'd do differently, or if there's any questions that you have about anything I've brought up. And thank you so much.